Hello, and welcome to the webinar on how municipalities are addressing increased demand for safe public space. My name is Kate Kraft, and I'm the Director of America Walks, and I'm here with my colleague, Kelsey Card, Operations and Development Manager for America Walks. Thank you for joining us. Today's webinar is provided in partnership with our colleagues at UNC's Pedestrian and Bike Information Center and is brought to you by generous support of our sponsors that are listed on the slide. Before introducing today's topic and speakers, I want to let you know that you can find a link for closed captioning in the chat box. So please use that if you're interested. And also, we want you to join the conversation. So simply click the tab marked questions in your GoToWebinar window and then type into the box, and we will address as many of your questions and comments as we can after the presentations. For questions that we don't have time to get to, we will ask the presenters to provide written responses, which we will post with the webinar recording that will be available later. We have three distinguished presenters with us today. They will be providing us with an analysis of the policy and public space interventions that are being reported from around the country and engage you in a few questions to help us understand more about how COVID-19 is impacting you and your community. We will also hear about tools that you can use to improve the local data about pedestrian activity. Our first speaker is Tabb Combs. Dr. Combs is an expert in the built environment and travel behavior connections and conducts research for PBIC. She will present data on community characteristics and the interventions they are employing. Next, we will hear from Hayden Black-Walker. She is a planner, and we like to say a past America Walks Walking College Fellow. She's going to tell you about the exciting work being done in Austin, Texas to make streets safer for walking. Then we'll hear from Dan Jolene, who is a Senior Research Associate at UNC Highway Safety Research Center and an expert on road safety. Dan will review a number of tools that PBIC has developed to help communities better understand and track pedestrian behavior. Before I turn it over to Tabitha, I just want to remind you that you did complete a few survey questions when you registered, and we will be sharing that data with you throughout the webinar. And we will be asking a few other questions, starting with the polling question on your screen. Take a few seconds. We're waiting for the polling question. Take a few seconds and provide the answers, if you will. Okay. All right. Took mine a minute to see. Please select your answer. And can we have the results, Kelsey? All right. Okay. Well, as you, it's taking a little while for me to get the results, but hopefully you've seen them and you know how many of you are seeing some changes in your community to increase access to safe walking and polling. And yes, all right, that's pretty good. 55% yes, 26% no, and several of you do not know. That's a lot of change going on. Our hope is that we can really provide you with some reference points for how different communities and individuals are adjusting to social distancing and finding safe public space. When you registered, we ask you this question: changes you've observed in walking and biking since social distance guidelines were implemented. And just to be, I think there's good news here. The vast majority have seen increased activity while maintaining social distance, or increased activity not maintaining social distance. But you can see most people are reporting increased activity in their communities. There's a small group that are less active, but generally we're seeing a lot of activity. So I want you to keep that in mind as we start to hear from Tabitha about what changes, the specific changes that communities are making. Tabitha?
Good afternoon, everyone. I'm Tabb Combs. Thank you, Kate, for that introduction. I am a research associate in the University of North Carolina's Department of City and Regional Planning. I work on a wide range of research on mobility and road safety. I'm particularly interested in the impacts of transportation planning practices on mobility and access, especially for pedestrians and bicyclists. Probably like many of us here, COVID-19 has had a profound impact on my work, as cities around the world are grappling with rapidly changing demands on how we use public space, especially our streets. I'm going to share briefly with you a high-level view of some of the actions cities have taken to respond to these changes in demand, talk about trends we're seeing in those actions, and then hopefully with your help, start to gain some clarity on the long-term implications of these actions, including their potential for becoming permanent features of the urban landscape, and grapple with questions of equity, disparities in benefits, and unintended consequences. The actions and observations I'm sharing today come from data I've been collecting since mid-March. This data set is hosted by the TED Bike Information Center and represents a high-level view of initial responses as reported by users, observers, city staff, and the media in cities around the world. The main goal of the data is to document officially sanctioned actions that affect walking and biking conditions to inform practice and research. We're now up to 335 discrete actions in over 260 cities, and we invite you to add new information to the data if you know of some interventions we've missed, and I will post a link to the data set at the end of my slides. The interventions we're seeing fall into 5 main categories. The first kind of intervention is the curtailing of non-car movement to limit virus transmission. We've documented 46 of these actions, and we know there are many more because many of you reported more of these actions in your registration surveys. Among the actions that appear to be aimed at expanding access to walking and biking, we've got 2 main groups. The first one is improvements to traffic safety and access to existing facilities. This includes reductions in speed limits, which we've seen in 19 cities, and automation of walk signals, 48 cities. The second group here is the reallocation of roadway space to non-car modes, expanding curb space, things like pop-up bike lanes and widened sidewalks, 120 cities, and closing streets to all motor vehicle traffic, 87 cities, and creating shared or filtered streets where cars are technically allowed but discouraged and deprioritized, 62 cities. The next big category, which doesn't really affect movement, but does affect how roadway space is used, is the 39 cities that are allowing restaurants and stores to use street space, parking, and maybe somewhat self-defeatingly sidewalk space for retail and dining. So we've got 16 cities that are fast-tracking planned implementation of new walking and cycling infrastructure interventions. And then finally 78 relevant other actions. But right now, I want us to zero in on these. We're going to explore a trend and adoption of these various interventions. And this gives us some pretty important clues as to where cities are in their COVID responses and what's driving their decision to act. So this graph shows the total number of interventions, not including the restrictive ones or the ones in the fast tracking or other categories, in effect since the first one we recorded on March 16th. So this takes us through the first 3 weeks of the pandemic starting mid-March. So we see that things get rolling with street closures, mostly in cities that already had open streets events. which makes this seem like fairly low-hanging fruit because these were places that were already sort of accustomed to putting on street closures or open streets events. The next we see the introduction of automation of walk signals. This is also probably low-hanging fruit because it's relatively simple. And then a few places start to explore curb space reclamations, things like expanded sidewalks and pop-up bike lanes, and then shared and filtered streets. For the most part, these continue to grow over the first few weeks of the pandemic. As we get into April, we see the relative popularity of curb openings and shared streets increase, and we see a little bit of a drop off in automated walk signals. This is probably because cities that were going to take this action have already done so. Then in late April, two interesting things happen. A sharp uptake in curb space expansions and the introduction of repurposing street space for outdoor dining. So this is an important inflection point in the response to the pandemic because it corresponds closely with the point at which cities around the world begin loosening up stay-at-home restrictions, and leaders start thinking about the best ways to support cities throughout what we now know will be a very long recovery process. The growth and reclamation of curb space continues into May and in large part reflects the unveiling of comprehensive new mobility plans in major cities across Europe and Canada, as leaders there start to think about how to sustain elevated levels of walking and cycling into the future. And then back in the US, where our stay-at-home orders have really since the beginning been competing with calls to open the economy, we start to see the effects of push to allow restaurants to expand into public outdoor spaces in order to comply with drastically lowered occupancy restrictions. And that's the bright purple line you see there, taking a sharp upturn around May 10th. And that's up to 39, I think 40 cities as of right now. So these are things that are readily available in the data, and I invite you to go play around with it, see what other stories are in there waiting to be told, because there are a lot of ways that we can pick apart this data. But I also want to talk about things that aren't necessarily reflected in the data. So from a planning perspective, there are questions that are at least as critical as the question of what actions have been implemented and when. And that's because this is where the lessons are for understanding what the likely long-term impacts of these actions might be. Things like, how was the decision to act or to deliberately not act made? Who was involved in that decision? Who's benefiting from that decision? What barriers had to be overcome to implement interventions? What makes some interventions durable? And what are the unintended consequences of the decision to act or to not act? So we can't answer all of these questions, but I really hope that you can help us start to answer some of them. And that brings me to our first polling question. I'm not sure if the poll is up yet or not, but I can go ahead and read the question. If your town, and you don't have to represent the town here, if your town has made a conscious decision to act or not to act to respond to changing demand for street space, how was the public engaged in that decision? So please choose the one that best fits your town situation. No public involvement, completely top-down process. Some public engagement, but many communities were excluded. Concerted effort to include diverse populations. I don't know, or this is something I'd like to comment about later. I'm not sure if the poll is up, but I assume it is. We'll take about 10 more seconds to collect responses.
Thanks, Tabitha. So we've got about 50% voted.
Okay.
So we'll give it a second here. Looking
Sure.
good.
Tell me when to go on.
Okay.
All right, ready to move on? Okay.
We're at about 56%. So if we feel ready, we can do that. Yeah.
Yep. Yeah, that's
Close
probably
the poll. All right. Last few seconds to get your votes in. And closing it up here.
All right. So while we're waiting,
No, go ahead, Tabitha.
okay. While we're waiting on the responses, there are a few factors that I've seen playing into various cities' decisions to act. We're on the topic of public engagement at also 1 o'clock, so I'm going to jump all the way over to the far right, our box on equity. Been a lot of pushes for cities to question whether their actions during the COVID crisis are equitable. And there are a couple of
Tabitha,
questions.
so we've actually got the poll up, and then I'll toss back to your slides. Did you want to read the results now?
Sure, yeah. Throw
Okay.
those up.
So 27% at no public involvement, completely top down. We've got 26% at some public engagement, many communities excluded. 10% came in for concerted effort to include diverse populations, and about 34% said, I don't know. And 3%, I'd like to comment about this later.
Okay, great. So I think that's pretty striking. 27% with no public involvement and a completely top-down approach, and that's hopefully something that we can talk about a little bit as we move forward. And that ties into this next slide. Is the next slide showing yet?
Your slides are showing, yes.
Okay, great. Which is, if you go to the far right, this equity box, one of the questions that cities really need to think about is, do you have to circumvent normal public engagement processes in order to facilitate a rapid intervention? And if so, it's important to think about how you're going to address pushback from members of the public who are excluded from the decision-making process, whether or not you'll be able to identify unintended consequences, and whether you're going to be able to roll back your interventions if it turns out that that's necessary in the future. The next question, do actions require involvement by law enforcement? If that's the case, we can say off the bat, it's probably not an equitable action. And then finally, think about whether you're going to be able to evaluate the distribution of costs and benefits. And that may be something that Dan can touch on a little bit later. So that moves us into my next question. If your town did implement some sort of roadway reallocation intervention, was that action part of or in alignment with an adopted plan? And your response options here are yes, no, and they were an extension of existing activities. And I realize that could also be a yes or a no, but please just choose whichever option you think best fits the situation. And if you don't know the answer, just go ahead and skip it.
We're at about 30% voting. We're seeing that some people, it looks like, aren't able to vote on the polls. So we're looking into this. I think it may be something on the user end. So we will try to get back to you with how to fix that. But if you can vote, please do.
All right, Kelsey, do you think we're ready to move on yet?
We're at about 42%. So if we want to give it like 15 more seconds, and then I'll close it up and. Okay.
All right, and keep your polling fingers ready, everyone, because I have one more question for you, which we'll get to after Kelsey tells us the results of the second one.
Yeah, so for were your town's actions part of or in alignment with an adopted plan, we have 27% of yes, and 50% said no, and 23% said they were an extension of existing activities.
Interesting. Wow. Okay. That is really that's surprising. I'm actually surprised that it was such a high number for the percent yes in accordance with an existing plan, and I find that to be that's a pleasant surprise. That's pretty inspiring to me. And then that rolls us into our final polling question for my section. And this is a question I'm asked a lot. It's one that I think cities and perhaps a lot of advocacy organizations are curious about. Which of these actions are going to last beyond the stay-at-home orders? So the question is, if you live or work in a city that did take action to increase support for walking and bicycling, were those actions intended to be strictly temporary, but might be made permanent? They were made as permanent from the get-go, they've already been canceled, or some or all of the above, And please, again, choose whichever option fits best.
We're at about 40%, so we'll just give it a little bit more. If you haven't voted yet, try to get in there. We're seeing some people provide some helpful tips. So if you're in full screen mode, you may not be able to see the voting. So maybe take your screen out of full screen if you're still not able to.
All right, Kelsey, where are we?
We're at about 50%, so I can close the poll here.
Okay.
And the results are in. So for were the town's actions to increase supports for walking and cycling intended to be, we have 22% came in at strictly temporary, 43% at temporary but will or might be made permanent. We've got 12% at permanent from the get-go. 4% say they've already been canceled, and 19% say some or all of the above.
All right, great. Thank you, Kelsey, and thank you all for participating in that poll. So 43% temp to perm and 12% permanent. That's interesting. That I was also surprised by that. And the 4% canceled. I'm curious to know what precipitated those cancellations. If they just expired or if there was pushback. So maybe some of you that answered canceled there can contribute a little bit more during the Q&A part of the webinar. I'm going to go ahead to my last slide, which are my interpretation of the most likely keys to durability. But before I share my insights about what I think makes actions more likely to stick around, I want to emphasize that we should all be wary of making permanent decisions during a time of crisis when equitable public engagement is nearly impossible to achieve. But at the same time, I do want you to keep in mind that doing nothing is also a decision. So continuing with the status quo that doesn't provide for safe movement for pedestrians and bicyclists is also a decision with far-reaching and long-lasting consequences. So it's not that doing nothing is the equitable thing. So just keep that in mind. So what makes an action a candidate for durability? Really anyone's guess at this point, but my predictions are that for an intervention to be durable, the city needs to either be rolling out actions that are in line with adopted plans, and 27% of the ones that you all represent are, or at least in accordance with preferences that have been expressed during ongoing planning processes, or designing actions that can be monitored for impacts and unintended consequences, and require only passive interventions, meaning they don't require staff resources or, more importantly, law enforcement to maintain, and they stem from a planning process that's inclusive, flexible, and responsive to the diverse needs of community members. That's all I've got. That's about all the time I have. So I really appreciate you following along and responding to the polls. My email address is here, and we have the link to the all of the data up at the pedbikeinfo.org website.
Okay, hello everybody. Kelsey, can you guys hear me okay?
Yes, all is good.
All right, perfect. This is Hayden Black Walker. I'm really glad everyone's here with us today, and I'm really excited to share with you what's going on in my hometown of Austin, Texas. So I'm going to frame this discussion about data and how we as local advocates push for slow streets and what's happening now and how we're gathering data. I'm a board member of Walk Austin, which partnered with a lot of really great organizations to get this done. And Walk Austin's board chair, Adam Greenfield, really led the effort. I'm grateful for everything that he has done. As Kate mentioned, I am a 2016 graduate of the Walking College, and I love how the college really does such a good job of training local advocates and building up capacity on the ground. I think our cities are becoming more walkable in large part from what they're doing. So a lot of people supported this, people who support Vision Zero, walking, biking, parks, open space, trails, and they work together to really create these new places for people. And it really wouldn't have happened without a team effort. And we're just grateful to everybody, including the City of Boston and the hardworking staff there. So to jump right to the good news. Okay, my slide is not advancing. I'm so sorry. Oh, there we go. All right, just took it a second. We do have slow streets, which we are calling healthy streets, on the ground in Austin, Texas. These were deployed as of last Friday, so they've been on the ground for 6 days. So we're still in the beginning stages of this. There are 3 segments of healthy streets in Austin, and they're each about 3 miles long. So in Austin, we recognize, like a lot of places, that people needed to get outside and move during the pandemic, but our parks and particularly our trails were really overcrowded, and there was a lot of concern about people not being able to socially distance. Healthy streets provide additional space for people to walk and to roll and to cycle and exercise and get to their essential jobs, all while maintaining that social distance. The Austin program is modeled on the successes of other cities. So we didn't feel like we had to reinvent the wheel, which is really helpful. We looked to all of these cities for guidance. Particularly Oakland was a really good model for us. So as you see in these pictures, and like many other cities, we're using A-frames to hold up signage. We're using cones and barrels to notify drivers that the streets are meant to be slow places. Some of them are closed, but primarily they are spaces for cars to move at a slow speed and share space with the human beings that are on the street. And those humans are supposed to take priority on these streets. So I will say, when America Walks first talked to me about this, I said, oh my gosh, you know, I'm an advocate. I'm not, I don't collect data. I don't have the resources to go out and do pedestrian counts. And I had to really take a step back and think about the fact that we used a lot of data, primarily data that's available and out there. It's either open sourced or it's in the media, to just compile together to make the case for healthy streets in Austin. So America Walks is going to share with you, we provided the letter that Walk Austin led with, but we also had 30 of our partner organizations sign on with us. And I think that made a big impact. We're also providing the press release and the petition that Walk Austin created. They were able to get 1,100 signatures on that petition within just a few days to help City Council see that there was a lot of community support for this. And we've also provided the final resolution from our City Council that might have some language or some data points that you could use, and a link to our the City of Austin's Healthy Street webpage. You really want to, if you can, go and see that webpage that the city created. I know a lot of cities have different ones, and there are different examples out there. This one is very interactive, and so it's collecting a lot of data and providing for some of that community engagement that wasn't able to happen with a very quick rollout. It has a survey that helps kind of identify how people are using their streets differently with COVID-19 and how their commutes have changed. It also has an interactive map where you can go in and you can highlight what streets you think should be future healthy streets. It has a way that you can comment on other people's suggestions of healthy streets, and a way that you can comment on healthy streets that are already open. And I just want to note that you'll see on some of my slides some quotes, and those quotes come from people, just the general public, who are commenting through that interactive website. So I want to take a step back for just a second and recognize that there are groups out there, and I'm only going to name two, but there are more, Better Block and Street Plans Collaborative, that have been doing this kind of tactical urbanism for a long time. They've been taking lightweight, temporary materials and modifying our streets to create more public space. Street Plans also has this tactical urbanist guide, which is online and free for you to use. It's an open source material. And they've really been showing us how we can use lightweight materials to iterate, change the design over time, and then eventually sometimes make these permanent. We also in Austin have been celebrating Parking Day for many years. Parking Day happens around the world on the third Friday of September, and this is one of the installations from a couple of years ago. So this is really good practice for thinking about how we might use our streets in different ways. And then I want to say that the City of Austin, with the stay-at-home ordinance, jumped really on this really quickly and did a couple of things. Both of these already had substantial community engagement. This one is Pleasant Valley Road, which crosses Longhorn Dam at the bottom of Lady Bird Lake. You can see there's a 4-foot sidewalk. There never has been, and of course there currently isn't room to pass each other on this sidewalk with that chain link fencing, and there's certainly not enough room to provide any social distancing. There are barriers, there's no way to step out of the way. Because the city had already done a very extensive community engagement process about this bridge, and we're trying to plan for a pedestrian and bicycle only bridge that's parallel to this. They were able to go out quickly and cone off one of the car travel lanes and take down the chain link fencing and put up temporary signage. So now people have a way by bicycle or wheelchair or walking to get across this bridge in a much safer manner. The other one that the city was able to do quickly was Riverside Drive, which you see here in red. You can see that it cuts through parkland. It was rebuilt a number of years ago permanently as a street that was to carry slower traffic. That roundabout helps slow traffic down. It was meant to be kind of a low volume, low speed street through parkland. And it was built to be able to be closed off regularly for large events like our 4th of July celebrations that happen here. So the city went out and closed it off almost immediately and opened up this space. I've been out to take a look at it, and what I primarily see are people who are rolling on bicycles or scooters or skateboards using the street area, and then so it's leaving the park space and the hike and bike trails available more to people who are walking and jogging. I want to point out that your city may not regularly close down streets for this kind of thing, for kind of an open streets, slow streets movement. And certainly the cities that we saw around the world that do that regularly jumped on this more quickly because they were used to doing it. But cities do close down streets all the time for things like utility work and street repairs and tree trimming and parades. So this is not unheard of, and they do have the signage. So this project started with an advocate meeting, of course, by Zoom, and drafting a letter to City Council. As I said, Walk Austin led on that, and 30 other organizations signed on within just a few days. That letter went to Council. In that letter, I want to point out that while we were asking for slow streets, we also asked for walk signals to be put on an automatic recall, so that you don't have to touch and push a button to actually get a walk signal across the street. And we asked for more leading pedestrian intervals. We've had enormous success with LPIs in downtown Austin, and people really like them, and so we were asking for more of them throughout the city. So Councilmember Ellis, Paige Ellis, was interested in creating a resolution, and her staff did a great job doing that, working with Adam Greenfield, and as I said, got 1,100 people to sign on in less than a week. That petition went to demonstrate public support for this project. The resolution was put on the council agenda. So we went from, advocate letter to a city council vote in 2 weeks, which is pretty extraordinary. And then the resolution had built into it a request that city staff come back to council in 2 weeks with a complete program, an interactive website, signage for the program, and the first Healthy Streets opened. So this is a super rapid process. Like, I've been an advocate for a long time, and this is like nothing I've ever seen before. It took a lot of hard work from a lot of people. Now that the webpage is active and Healthy Streets are on the ground, we can see what people are thinking. And as I said, some of my quotes are on these slides, not my quotes, quotes from people who are providing public feedback. While most of those quotes are positive and really inspiring, and a lot of them ask for these improvements to become permanent, I would say about 95% of them are positive. I did go through and count them. There have been some issues, and I think it's important to remember that because this is low-cost signage and materials that can be moved around, it's not permanent. It can be iterated. So this is an example where this has already happened just in a matter of days. This is Comal Street. On the left, you will see that the road was posted as closed. There are local business owners here, particularly local bars and live music venues that are already being hurt by COVID-19, who were frustrated and wanted it changed. And the city went back out within days and changed the signage to local business access. And so you can see what that looks like on the right. And then I just want to quickly highlight some of the things that we talked about in the resolution and in talking with City Council. And this is all data that you have access to also. With the stay-at-home orders, we saw a 50% reduction in traffic. I'm a Vision Zero advocate, and I really hope that that would mean that there was also a big reduction in fatalities and serious injuries. That did not happen. City staff believes that's because of egregious speeding that we're seeing happen in a lot of parts of the country. So unfortunately, we have half the cars out there and they're killing just as many people on our streets, which is very concerning. We were seeing increased numbers of calls to mental health hotlines, and I know there's a lot of great research out there showing that physical activity can significantly improve mental health. We're also seeing a documented overcrowding in our parks and along our trails. The Trail Foundation was out taking counts every day and reporting them to the mayor's office. And with that, we have this disturbing news from the University of Texas. Your communities are probably seeing the same kind of modeling that's showing probably a secondary and tertiary wave of COVID-19. The Trust for Public Land has studied 100 cities. Austin's one of them, and shown that in Austin, only 40% of our residents live within a 10-minute walk of a park. So Healthy Streets is a way to provide outdoor recreation space for those people. And we cited existing city policy. We're lucky enough to have a strategic mobility plan in place that actually recommends using quick and inexpensive pilot projects to test street design. So this is a list of other open source material that just off the top of my head, and some resources. I will point out that NACTO just released their pandemic response and recovery guide last week. And then of course the good folks, Tabb and Dan, that are on this webinar with me have great information from PBIC that's open source that you can also get. And then I just want to leave you with one final thought. I love this quote. This is my favorite one of all the many quotes that are coming out on the city's interactive website. But this shows, a young couple walking on one of our new healthy streets. And this street, like almost most of our neighborhood streets in Austin, have no sidewalks. And the city's 2016 sidewalk master plan identified that it would take about 100 years at the current level of funding and just north of $1 billion, not $1 million, $1 billion to build all the missing sidewalks in Austin. And I don't want to have to wait 100 years. I won't be around. And I would rather figure out a more efficient and cost-effective way to do this. So I think it's really important to think about the time and the money we could potentially save as we use this Healthy Streets model, and we learn, we gather data, we iterate, we try to perfect it, and hopefully we can put something in place that's permanent, that really gives people a safe space to walk, because we need that. Thank you very much.
All right. Hi, everybody. My name is Dan Jolene. I'm with the UNC Highway Safety Research Center and the Pedestrian and Bicycle Information Center. I want to follow those two excellent presentations with a little bit of a discussion about some tools that are available to you that can really help you document some of the demand in increasing active transportation during this time. Maybe some of these are ones you're already using. Maybe they're new to you, but we're hoping to leave you with some resources from PBIC and from other organizations that can help you really document and tell these stories. I wanted to just mention, there are a few reasons why we want to measure and monitor this demand. I think the most immediate and the most obvious one is that we want to have an immediate response to the need we're seeing. And we've been talking about how cities, states, and others are responding to that by opening up more space for biking and walking. So being able to make the case for this immediate response, having some data to help back that up is really useful. We also want to be thinking about long-term plans, long-term investment, possibly in, if we see these and we can measure that these interventions are successful, what's to keep us from making some of these permanent looking forward. And we're seeing some evidence of that, but having data can really help sell that point and make that point more compelling. And then finally, we want to be able to measure the impact of what we're doing, whether we're doing just simple day-to-day transportation projects or really looking at what the interventions we're doing around COVID and other public health crises are, what impact they're having. What are they allowing people to do? Are we seeing increases in walking and biking, decreases hopefully in conflicts between road users? Having data on hand to help tell that story is really valuable. And there are a few types of resources and tools that I wanted to talk about. Those are counts of bicyclists and pedestrians, how we can use data about motor vehicle volumes to make our point. We can use a lot of field observation and audits and other types of observational data, as well as surveys and community feedback. And in the registration process, we asked you all which of these you're using, and we got some great results from that survey. The most used type of data that we heard about were those field observations and audits. 25% of you appear to be using those, and then several others using these other data types. But you'll notice that these don't all add up to 100. In fact, there were 43% of you that said you're using some other type of data tool. So this is not an exhaustive list by any means, these 4 categories. And I'm really interested to hear from you all about maybe what those other data types are that you're tapping into. But if I can go through these briefly here, I think the one that we all think about right away are those pedestrian and bicyclist counts. How many people are walking and biking? And we know that there's a real lack of good data on the amount of biking and walking that we have going on in our communities. But if we have access to count data, it allows us to really measure those changes in biking and walking activity, maybe from prior to this sort of public health crisis that we're in now to the current status. And then moving forward, the communities that have established count programs with these continuous and short duration counts, really well-placed counters are able to tell that story. But in the absence of having those count programs, which can't really be set up overnight, you still can go out and collect some really valuable data using manual counts. Some guidance that is out there really provides the way to do that. Some of the resources mentioned here and all the other ones in my presentation will be linked on the webinar recording page, so you'll have access to those. But I did want to share one story from the city of Memphis. They do have counters and a count program really going and on the ground. It's been, these have been in place for some years now, and they're able to tell a story about what they've seen change in the past few months. Without the count data from prior to this event, they wouldn't have been able to do that. But you can see that they're really able to compare what's happening now with some historical, maybe 4 or 5 years back in time with some of those baseline measures. And that tells them a lot about how people are getting around now and helps them react and respond more quickly to that change. If they didn't have that data, it wouldn't be as clear about where those where the additional biking and walking space might be needed. So a really valuable example. I hope you'll check out the blog post they wrote and really shared a lot of the data that they're seeing. The other side of the coin, I think, is to look at the amount of driving that's happening, motor vehicle activity. We've heard some mentions already of reductions in vehicle trips that we're seeing. And I think you can use that in a way to help make that argument that people aren't getting around by car They need other ways to get around now, and maybe they're traveling for different purposes. Maybe it's more recreational, walking and biking, really serving that purpose. So looking at what data you can find on average annual daily traffic, those AADT numbers from your state DOT, possibly, or your local DOT, or even some other sources like location and cell phone data that's being aggregated that you might be seeing from third-party vendors. Those data don't exactly tell the same story, but they're all measures of reductions that we're seeing in vehicle trips, motor vehicle trips. And there's a really great platform that ITE has set up, sharing stories from several states, cities, and provinces in Canada about what traffic volume reductions they're seeing, ranging from 30 to 70% in some cases of vehicle trips reduced over the past couple of months. That data can be really valuable in helping tell a story around the travel trends that we're seeing right now and making a case for roadway and policy changes. I think the one that's really untapped is going out into the field and really observing what's going on. And there are so many specific behaviors that I think we're all noticing in this time that can tell us there is a need for more space to bike and walk. How many times have we been traveling down the sidewalk and seen a person have to step into traffic or into the street to allow that 6-foot minimum passing distance because they don't want to get too close to anyone else? Those are observations that can be coded and collected and really documented in some way to show, these behaviors are ones we're seeing, and we can come up with some policy or environmental change responses to make those make those behaviors more safe. Others might be speeding, which is another good observational data that you can collect in the field. There are some really useful prompt list guidelines and audit tools out there that we've linked to that can really help you do that in a very systematic way so that you can collect that data and share it back and tell a story with it. The other one I think we've heard a few things about, we've all seen these surveys of gathering this information about how we feel about what's happening currently, what we want to see. We're asking you all a lot of questions today about policy changes you're seeing and interventions. This graph demonstrates how we might see one thing from using maybe a more quantitative source like crash data or count data, but we might, if we ask people how they feel or what they're thinking or what they want to see, we might see a totally different story comparing user perception and user needs with those more quantitative objective measures. And so one thing I would want to encourage everybody to do is be thinking about how you can properly and equitably, as Tabb said, really collect some of this data. Know how you're, think about how you're framing your questions, how you're choosing what to ask certain people. Consider the blind spots in your data collection. Is everyone seeing or able to interact with your survey and provide their responses? Are there any groups that are not able to share their perspectives with you in the method that you're using? And are there other public-facing tools such as interactive city websites and other means that your city has access to really gather input and feedback from people? But I want to encourage everyone to really think about user feedback, community feedback, and engagement as data. It can stack up right alongside counts and other more quantitative measures. And considering that, especially now when we really need to be reactive to what people need and what people want, I think it's very important to really lean on community feedback. With that, we did want to ask a poll question of you all to really get a sense of the types of data sources that we've talked about here, the counts, motor vehicle volumes, field observations, and surveys and feedback. Which one of these do you feel could help you make the most compelling case for changes in your community? So we'll leave that open for a few moments while you all cast your votes. It's hard to pick just one, and I think one other takeaway point I'd want to reiterate is that you want to be using multiple data types if you can. One of these might not tell a very compelling story, but multiple data types really could show a lot of things and communicate a lot of trends. And Kelsey, I'll let you decide when to close that poll and share out the results.
Thanks, Dan. Yeah, just a reminder, if you are in full screen mode, you may not be able to see this, so get out of that if you can. And once you select your answer, make sure you hit submit as well. So we're at about 50%, so we'll give it maybe 15, 20 more seconds here. While
You're gathering your responses to that, I did want to forgot to respond to a question that came in during the registration process, and it's if we've already started, or if we've gotten to this point now, is it too late to really start collecting data? Have we missed our chance? And I think the answer to that is definitely not. The more data you can collect, even in the midst of changes happening, is really valuable, because we don't know, as we all know, we don't know what's going to be happening next. Things can change very quickly in either direction. So having data, collecting it now and continuously, is really going to help us tell stories moving forward. So it's not too late to do any of that.
All right, we will close the poll now. Oops. All right, so results are in. So which of these tools would help you make the most compelling case for changes in your community? Looks like 38% said counts of bicyclists and pedestrians, 11% said tracking reductions in motor vehicle volumes, 21% for field observations or audits, and 30% for surveys of community members.
Great. That's awesome. I think that's a fairly even distribution between a few of the options, and I think that shows that there are some compelling cases to be made for several of these data types. So hopefully those are ones you can tap into. If you can't collect them yourselves, I bet that there's a resource in your community that can help you find them. I wanted to help wrap up all of our thoughts before we head into the Q&A. Some of the big takeaway messages and what you can do moving forward from here. I think the key really is to learn from what other communities have done. There are a lot of communities doing some experiments with this stuff right now, and I think you can look to them for inspiration. If you're not with a city or with a transportation agency, your community organization can really be valuable in mobilizing support around making some of these changes and to champion them, because I think your transportation agency may get pushback against doing some of these things, and I think it's valuable for the community organizations to be ready to help cheerlead those and build support behind them. And picking at least one of these tools to think about how you can monitor demand, even if you haven't started yet, moving forward, how you can begin collecting some information about what's happening and use that to tell a story, it will be really valuable. So I appreciate the time, and I think we have some time for Q&A now.
Thank you, Dan. Thank you, Hayden. Thank you, Tabb. I've been watching some of the questions as they came in, and just remind people that you can submit questions in the question box if you have others. But we've had some questions about concerns for equity, and in particular concerns for communities of color. And I'm wondering, Hayden, if you could talk a little bit about how your work in Austin has included and reached out to or not communities of color.
So thanks, Kate. One of the things that I didn't, I hope it's sounding okay, I'm getting a weird echo. One of the things I didn't touch on was we're creating a community block captain program with the city, and that's very focused on both communities of color and potentially even older citizens who need safe walking spaces and don't have them and are not always. So the idea would be there'd be these volunteer community block captains, and the city's survey that they have on the website does capture if people are willing, and then our nonprofit organizations are reaching out to people so that we can start to make sure that we have community volunteers on the ground in multiple neighborhoods all over Austin, and we are getting direct feedback through that volunteer system from those people. I will also say that of the 3 streets that were put out there, first is Healthy Streets last week. 2 of them are in underserved communities. So that's part of the way that we're trying to address that.
Thank you. Thank you. We also have a number of questions about just confusion around implementation of slow streets. And I'm wondering, Tabb and or Dan, if you could maybe clarify a little bit around what it takes in the implementation of slow streets.
Tabb, I could start on that. I know the confusion, it could be with the questions that are coming in. I know that there has been confusion when some cities have implemented the slow streets, exactly what that means, and that the terminology used, I think, can create confusion, especially for if you're allowing through vehicles, you're not closing the street completely. What exactly does that mean? I think that that's valid, and I think the different types of messaging that goes out and the signs that are put up can really help communicate that. For what I've seen, most of the confusion is where some of the more standard construction zone signs are used, and people aren't quite sure what's going on. Whereas there are some examples of really great signage that the cities have developed to really be clear about what the purpose of that is. So if there's, I think that looking at other cities and what they're doing and some of those examples would be valuable in that case. And some of the messages are more clear than others.
Yeah, I think Dan hit on the most important, the key points. I would add that adding to the confusion is that the same action may be called different things in different places, and different actions may have the same name in different places. And so really figuring out what the lingo, I think, is a big part of it. And that's something that I've struggled with collecting the data as well. So it's more important to look for examples of places that are doing what you want to do than to look for examples of places that are using the same terminology as you.
Yeah. I guess, Dan, this is for you. Are there community surveys that are already made and could be tailored to a different community to feel how the public feels that can be used online and through paper copies?
Yeah, so the last bit on the paper copies, I'm not sure. I think what we're seeing now is real uncertainty about what can be done surveying sort of in person and on paper, but the online platforms have been successful. I don't have a standard survey that sort of we've developed or sort of are distributing, but I would encourage you to just, really go to some social media sites and cities that are doing surveys to ask people what they're interested in. Some of the questions that they're coming up with are really great. And so I would really look to other cities for inspiration. Those questions that ask people, how their behavior has changed and what they want to see happen. Some of the similar language that some of the Tabb survey questions or poll questions had in them, I think are really valuable, helping people really identify what it is that they want to see come out of a program or a response. And some cities have even developed little reports on their websites devoted to this, demonstrating what they heard and how they're responding to it. So looking at those websites and seeing what was asked, I think could be a good place to start.
Next week, our nonprofit agency will be replicating the annual bike ped counts on area trails. Any special considerations we should be thinking about? And I'm going to give that to everyone. Maybe Tabb, start with you.
Well, I think the first logistical challenge is being able to conduct field work in a way that keeps yourself safe. This is a different situation than I think any of us has faced before when trying to collect field data. And then, I think one of the people that I heard from recently about this was Warren Logan from Oakland, who said that in Oakland, they combined public health reach, giving people information about COVID testing, with their Safe Streets and Slow Streets outreach effort. And so, making sure that people understand the connection between these various actions, so they can really understand why you're trying to do what you're doing.
Thanks. Hayden, any thoughts? Oh, go ahead, Dan. Then we'll go to Hayden.
I was just going to say really quickly, if you're doing it again and you've done it in previous years, do as much as you can to replicate the way you did it previously, so that you can draw sort of a year-to-year comparison. Similar spots, similar methods, similar people, if you can get them to do the surveys again.
And Hayden?
Kate, I'll just say I really haven't been involved with doing any pedestrian counts, so I'll rely on Tabb and Dan and their great advice.
Thanks, thanks. We have several other questions that we will submit to the panelists and get written answers for you. So I'm recognizing it's at the top of the hour. So I want to thank our panelists for joining us. It's been a very informative conversation. And thanks to our sponsors listed here. We couldn't do any of this without them, so we thank them a great deal. Just to give you a glimpse of a couple of things that are coming up next week, we have a conversation with Shane Omari, who is a neuroscientist, and he has a new book out on In Praise of Walking. And we will discuss the neuroscience of walking. And then June 10th, we have enhancing walkable spaces through public art. Would be an interesting conversation about how we add public art and design to creating these walkable streets. Thank you all for joining us, and please complete the survey that you will be receiving shortly. Thank you.